Good morning, everybody. My name is Keith Newby. I'm a cardiologist. I practice out of Norfolk, Virginia. So I've traveled a bit to be here because of how important this topic is. And I wanted to start off just by saying welcome this morning, and I appreciate you inviting and having me and sitting out to listen. I know it's tough on a Saturday morning. I'm sure you'd rather be somewhere else, but I'm glad you chose to be here. So one of the things that I think if you put up, I'm not sure if my slide can go back up, but I'm going to talk a little bit about a couple things. First thing is we talk about wellness, and I've kind of learned I don't use the word health that much. I use wellness more so. Health sometimes can turn people off and want to hear things, and it's just something, a stigma that Dr. Neighbors may touch on, but it's hard to hear about health. A lot of people think that's a bad thing, but it can be a very good thing depending on how you look at it. So why is wellness important? When you think about it, when you wake up in the morning, depending on how you feel, dictates how the day is going to go for you. If you feel very good about the day, I mean, you woke up, you had a good night's sleep, and everything was good. You get up and you feel good the next day, and how you spend that day, the things you want to accomplish will likely be enhanced based on how well you feel. So it's always important for that wellness aspect, but that's why this is important. Now, mentioned about life expectancy, and there is a vast difference between African American, white, Asian, and American Indian. And why is that? We'll get into that in a minute, but a lot of that's based on lifestyle. And I want to make sure we emphasize that as well. But that readiness to function at your best is what we want to make sure we touch on. Now, conditions that affect men most. Heart disease is still the number one killer in this country by far. Even when COVID was at its peak, heart disease still is number one. One thing I can say, I will never be out of a job. And and that's not what I'm looking for. What I'm looking for is to make sure I'd rather you put me out of work. I can find something else to do. That's I went to school forever. I can figure that out. But having you be healthy, have that life that you can prevent seeing me in the emergency room with a heart attack. A lot of people don't realize a lot of people die from heart attacks. They don't even get a chance to get to the hospital. So you want to really think about what are the things that's going to impact our men more. That's one of the things is heart disease, depression, hypertension, prostate cancer, cancers in general, lung cancers, colon cancers, diabetes, and of course, for most men, the dreaded erectile dysfunction. And we can say that, but listen, I got many people that will not take blood pressure medications because they're worried about that. I tell them, I said, listen, if you're dead, you can't do anything anyway. Just keeping that part real. It's the one thing that you want to always make sure that you prioritize things in the right way. Cancer rates, where we talk about what are the things that are important as it relates to cancer rates. Well, prostate cancer, especially in African American men, is still number one cancer. And I tell you, one of the things that really breaks my heart over the years. Now, I'm not a cancer doc, but of course, I have to deal with a lot of this because there's a lot of overlap in all our fields. But when you have somebody who ignores the signs and they think it's going to go away, that's the part that, and I'll get into this in a minute, but what you'll find when you look at cancer rates. Now, of course, for prostate cancer, there is a higher incidence of that in black men, no question about that. But when you look at cancer overall, there's not a lot of difference between African American and Caucasian as relates to cancer rates, but you'll find mortality rates, which is death rates, are higher in African American population. Why? Because we don't want to go to the doctor. We don't want to get checked out. We will avoid these things, and that's where we can make one of the biggest impacts is that life expectancy part. So when you talk about the highlights of the cancers, prostate's number one, colon's number two, colon and lung, kidney, pancreas, liver, esophagus, in that order. And when you see that, if all it's about is early detection, you'd be surprised how that can impact on that. Now, I want to spend a little bit of time about heart disease because that's my area. That's what I've been doing for 20 plus years is heart disease. Why is that important? Because as we talked about earlier, that's your number one killer of everybody, bar none. But you'll find that it will impact African American men more. Why? Because of causes of heart disease. Let me talk a little bit about what heart disease is. When people say that, a lot of people will say to me, ask me this question, do I have heart disease? First question I always, when they say that, I say, well, do you know what heart disease is? And of course, most people don't, because that's a very broad term. I mean, when I say heart disease, that'd be like if I say to you the word car. I mean, there's several types of cars. There's Mercedes, there's Jaguars. For those who are a little bit too young for this, Pintos, Gremlins. I mean, there's a host of different cars, and they all have different impacts based on the style and make and model. So look at heart disease as the same way. Heart disease, if you look at definition, that means anything that affects the heart or the great vessels. So the great vessels are your big aorta that comes out of the heart. That's your main artery that comes out, because really the heart is just a pump that's pumping blood, oxygenated blood to different areas to allow you to do what you want to do every day. If you're trying to walk, if you're trying to run, sitting, whatever the case may be, your heart has to pump a certain amount of blood out to allow that to happen. And the arteries that have to transmit that blood to all these different places is what is defined as heart disease. So if you have a stroke, that means you have something that happened to the artery in the brain, either a clot or embolus or some kind of whatever that disrupts blood flow. That's a form of heart disease. If you have a heart attack, that is a form of heart disease. If you have a peripheral vascular disease, which we want to just touch on it for a minute, that's blockage in the arteries in the legs. That is a form of heart disease. Why? Because it attaches to the heart. So the heart is that central organ that has to transmit all this blood everywhere. So if it gets affected, it can impact on your life. So when you talk about that, and I like to categorize that 4 different categories when I look at heart, just to keep things simple for the purpose of this. And when I'm teaching patients, I love analogies to give them things that they can relate to. So I look at heart, if you look at it like a house, in your house you have your floors, your ceilings, you have walls, you have rooms, you have doors that go from room to room, you have plumbing, you have electrical circuits. Well, the heart's the same way. Each room in your heart is called a chamber. And each door that leads from one chamber to the next is called a heart valve. So they have to open and close well. You have to have plumbing, which are like your coronary arteries. Those are the things that transmit oxygenated blood to the heart itself. The heart has to pump blood out everywhere else, but it needs its own food supply, and it gets it through the coronary arteries. Then you have structural problems. Think about if you have if your house foundation is faulty, it may not hold well over time. Well, if you have heart failure, that's like a problem with the structure of the heart, where it's not pumping adequate amounts of blood out to allow you to do what you want to do. So, and the thing that I want to really focus on here is what are the causes of heart disease. That's where our focus is, because that's the part we can really alter. If you think about what are the things that can cause heart problems: hypertension, diabetes, high cholesterol levels, people that smoke, people who are markedly overweight, and people that don't do much all day. If your main exercise is pushing a remote control button, that's the kind of thing that you will find those individuals are going to be at higher risk. And that's the thing you need to understand is these illnesses, these chronic conditions. Somebody has hypertension, that is a chronic condition. That means your blood pressure is elevated. So, understanding what is a normal blood pressure. And one of the things that I'm going to ask this of the audience, what is a normal blood pressure? Give me a number. Okay, I heard 120 over 70. Any other? Okay, I heard 125 over 80. Any other numbers before I answer that question? Okay. And this is not, and this again, interaction. This is not a trick question. But a normal blood pressure is less than 120 over 80. Less than. So that means 119 is normal. If your blood pressure, your top number is 120, that's an elevated blood pressure. And I know a lot of you guys have probably looked at me like I'm on drugs up here, but I'm not. That is a normal blood pressure, less than 120 over 80. Stage 1 hypertension is if your top number is 130 to 139, or your bottom number is between 80 and 89. That is considered either one. So if you're 120 over 84, that's stage 1 hypertension. If you're 134 over 70, that's stage 1 hypertension. Stage 2 hypertension is if your top number is 140 or greater, or your bottom number is 90 or greater. Now, why are these terms relevant? Because look at what it can cause. Hypertension can cause heart attacks, can cause strokes, it can cause heart failure, and it can cause kidney failure, amongst other things. So when we talk about trying to get somebody's pressure down, I'll have somebody that will come to me, see me in my office, and they'll say, well, my pressure is one. Like if I check it, I say, your pressure is high. And it'll be like 160 over 100. Oh, that's good for me. And I'm looking at them like, no, that's not good for anybody. Where you get that from? It used to be 200 over 120. I'm like, well, don't be proud of that. That's not a number you want. You want a number within a normal range. And they'll say, well, I feel lousy when my pressure is that low. I'm like, but that's not low, that's normal. I said, your body's been fighting this because you had high pressure for so long, your body's used to being high now. I said, but that's not going to help you lead that best life. You want to get those numbers down. Now, a lot of times I'll tell people, we're going to bring it down slowly, but we need to get it down. If your blood pressure is 130, your potential stroke risk is over 35% at 130. When I hear stroke alert in the hospital, and you look at these numbers, they're typically between 130 and 150, typically, the top number of blood pressure. So I tell people all the time, I said, listen, make sure that you are getting the proper information when you're going out looking at any of these types of illnesses or conditions. All not to do anything but just give the dose of reality for today. How people perceive aspects of medicine, and people will oftentimes say to me, I know my body, so I don't want to do certain things. I'm like, yeah, you know your body, but I know medicine, which is different. So you don't act like you know more than what you know. I hear you, and I respect how you feel, but you don't have the background, the understanding of how these conditions can affect you. And when you see somebody die from this stuff early, that takes you to a different place. I've seen more folks die over lack of knowledge or lack of understanding. And with that, and for me, I'm a deacon in my church, so I have a Christian belief that drives a lot of what I do and what I say. And when you see people die in front of you, that's hard to deal with, and that's hard for anybody to deal with. So I really encourage you to make sure that you do not only just learn about yourself, but your family members. When you have your Thanksgiving dinner, make sure you look at what you're eating, because you put that bacon, grease, and fat back in everything, then you'll be seeing people like me. But I'm saying all that to say the realities are when you're around the Thanksgiving or Christmas table, make sure you're talking to each other. Find out what your family's health condition is like, because again, that may impact you. If you find out that you had 2-3 family members have had breast cancer before they were 30, but we don't talk about that in our families as much. So then, that way may impact your daughter or your cousin or whomever. So you want to make sure you understand that family history. That's going to be extremely important. So, I say all that to say that things that we do, smoking, we have now in our community, everybody wants to smoke weed. When that became legal a couple of years ago, I don't think I walked through my hospital parking lot now one time. I don't care if it was 6 in the morning or midnight. I didn't smell some weed going on. And I'm telling them, I said, listen, guys, everybody said, well, this is not cigarettes. And I'm like, yeah, but you ain't seen the data. I say 42% risk of stroke with people that smoke marijuana on a daily basis. 42% risk. So there's no such thing as a benign anything foreign that you're putting in your body. So you want to always be careful. I had people that tell me when we were doing COVID vaccines, I don't know what's in the COVID shot. I don't want to take it. I'm like, you don't know what's in that weed you smoking either, but you do that. And again, these are just things I'm bringing up as realities, what we have to deal with in a health profession. People do what they want to do, and they believe what they want to believe. But our job, as I see as health care professionals, is to give you the tools you need to make sure you live that best life. And if we don't do that, then we're not doing our job very well. So again, when you think about risk factors, make sure you understand your health condition. If, really, you got to go to the doctor to do that. So make sure if you do have hypertension, if you are diabetic, don't take those diseases lightly, because they could end up causing you some major problems in the future. And I see diabetics, like amputations, strokes, heart attacks, kidney failure, and at least in my area in Norfolk, Virginia, you can't go into a dialysis center anywhere in my area and look and see who's in there. Like 99% African American, guaranteed 99%. I think in my practice I may have 2 white patients who have kidney failure, but 99% are African American. And why? Because of hypertension and diabetes is left untreated. Because again, if we feel fine, we think we are fine. And that leads to these outcomes that I hate to see continue to happen. So I'm going to really ask that you really take some of these things to heart and make sure you understand. If you don't ignore hypertension, and don't think if your pressure is high, that's normal for you. That's not normal for anybody. So you want to know and understand what those goals are and how to get there. So we talk about things that contribution of lifestyle, and that's probably one of the biggest things that we'll find that impacts, especially in the African American community, is lifestyle. I don't know if you ever heard the term social determinants of health. Well, we see this a lot now. These are the conditions in which we were born, we live, we work, we play, we worship, our built neighborhoods. What is in that neighborhood that impacts your health? If you don't have access to medical care, you can't go to a doctor if you don't have access. If there's a transportation issue, if you have housing insecurity where you're spending, over 30% of your house income is going to where you live, that means do you have money for other things you need to do? Where are our priorities and how do we get there? What type of education do we have? What are our access to these types of things? This all impacts on somebody's health because, again, if you go in your neighborhood, when I was driving, I had my Uber coming from the airport, I think I saw at least 7 liquor stores driving here, at least. I saw these chicken and fish, and I know it's just fried stuff. If this is the staple of your diet, that's the issue that we're going to run into because the fat, the sodium, the sugars and all these things lead to heart problems and from hypertension, diabetes. So these are the things that I know. And I know, listen, I hear you, it tastes good. Let's keep it real. A lot of this stuff tastes good. I get it. But that's what we're used to doing. But that doesn't make it's going to be good for your long-term health. There are other things out here that are equally good that you have to just try that could be much better for your short and long-term health. So I'm bringing this up to say those social determinants impact significantly on your health. Now, why is treatment important? Treatment is important for several reasons. One, early detection. If you have prostate cancer and that's addressed, more times than not, prostate cancer can be cured. If you have kidney cancer, which is something that we more stumble on than anything else, take out the tumor, a lot of times people are cured. Lung cancer, if you're smoking, that's going to put you at higher risk for things like that. But early detection, the earlier you find things, the quicker you can have it addressed. But again, unfortunately, so in our population more specifically, we delay care. We put things off. And it could be from various reasons. It could be access, whatever. But when you look at mortality rates in African American neighborhoods, you're going to see a higher risk of that, a higher rate of that because of lack of detection, lack of treatment. So getting these things addressed early, even when it comes down to preventive things for heart disease. If you address blood pressures early, you can oftentimes reduce your risk significantly to go on to develop heart disease. But we have to do it. So you have to first want to recognize that there's an issue there. And then secondly, you want to have it addressed. Because again, if you ignore it and you say, okay, I'm fine because I feel good. Some people tell me they only check their pressure when they have a headache. And I'm like, but that headache's probably coming from something else. It's probably not coming from the blood pressure. And so and some of that is just our avoidance, because if we avoid things, we're going to be fine. And that's not always the case. Avoidance is not going to help any of us, and it's definitely not going to help you. So you want to, A, make sure you're addressing and recognizing, and B, make sure that you get treatment if you need it. And don't, and please don't tell me you're taking your meds when you're not. Compliance in this country is 30%, meaning that you got 100 people, only 30% of the time you're actually taking your medicine. And that's a low compliance rate. Now, I've got people who could look me right in my eye and lie like I ain't never seen before. Oh, I take my medicine every day. But I'm looking at the bottles and I'm like, yeah, but Chief, you had this bottle filled 8 months ago. There's only 30 pills in here. How could you be taking them every day? Oh, well, I just put some pills from an old bottle. I said, well, the old bottle should have been empty too. I said, so come on, let's get to the reality. And I tell folks all the time, lying to me is not going to help, you at all. I said, if you want to really get better, you have to be honest with yourself about your issues. And listen, there's no perfect people out here. None. The only person I know is perfect lived 2,000 years ago. There's no such thing. I'm not, nobody on this panel is, and you are not. But to be able to recognize what your shortfalls are and be willing to address them, you can achieve more than you could ever even imagine. So that treatment aspect, making sure if you have cancer, get it addressed early. Don't ignore it. That's not going to help you. If you have high blood pressure, take your medicine. There are lifestyle changes that you can make in addition to medications. I tell people all the time, I'm not a big pill pusher in my practice, but I tell people, I say, what I need from you is 3 things. I need you to exercise. The American Heart says we're supposed to be exercising 30 minutes, 5 days a week. And that could be just simple walking. And like I say, if you come into church, you walk around the church. If you're at your job, get there 15 minutes early, walk around your workplace, and then walk around again at the end of the day. And that's your 30 minutes right there. And learn how to incorporate your activity in your day. You cut the sodium content down, 2,000 milligrams or less. And they really say 1,500 milligrams, but I know realistically 1,500 milligrams is like nothing. I mean, a teaspoon of salt is 2,300 milligrams of sodium, a teaspoon. So you think about all the foods you eat all day long, and people will say to me, oh, well, Doc, I don't ever add any salt to my food. I said, yeah, but you was in McDonald's yesterday. I mean, there's like a ton of sodium in there for you to get it where dear salt shaker. So you have to understand the nutritional aspects of what you're getting and what that all entails. But again, if you could keep that salt content low, and then with the exercise and weight loss, you can drop your blood pressure with just lifestyle changes, somewhere between 6 and 12 points, just on lifestyle change alone. But the hard part about it is getting people to do it. And again, I know it's not easy. Changing what you've done all your life is not easy, but that's where you have to, as a family. I tell families all the time, I say, if you're a husband, you got a wife, do things together. Go out and walk together sometimes. I know some of y'all may not like your wives. I don't know. But I'm going to go on the assumption that all you guys are Christian brothers and sisters in here, and you want to do right. So go out, take your wife out, and walk sometimes. Wives, take your husbands out, walk sometimes. You'd be surprised how much that can impact, but it has to be consistent. Patients would tell me, I walk every day at work. I say, yeah, but you're starting and stopping every 5 seconds. To train your heart, you have to get it up a certain rate for a certain length of time. And if at work you're not doing it, I'm glad you're getting those steps in, but to get the heart benefits you need, you have to do it continuously. So I said to people, that's how you get that down. You want to make sure you do that. So that prevention is going to always be key. Make sure you go see your doctor. Don't avoid us. If you don't like your doctor, get another one. It's going to be now. Don't just dump them because you just don't like what they have to say. I mean, you want to make sure they're getting you the information that you need, and you want somebody you can talk to and relate to, because that impacts how we receive information, how we convey it out to you is going to be impactful. That early detection is going to be key. Get your screenings done. Make sure if you're a certain age, you want to get screened for prostate cancer, colon cancer. I know a lot of men avoid that because they're scared of the finger. But it doesn't always have to be that way. But you want to face these situations head on and make sure, because again, your life may depend on it. Make sure your exercise that we talked about. Get rid of the cigarettes, the excess alcohol, and that weed, please. Again, I tell people, I'm like the Commodores, get high on sunshine. Don't get high on weed, because again, a lot of people think that, and I understand there are reasons people do that. Dr. Neighbors may touch on that. This stress, whatever the case may be. But you want to make sure that you're doing your part to be as healthy as you can. Take your medications like you're supposed to. If you're diabetic, make sure you understand what your hemoglobin A1C levels are. You know, if you're hypertension, make sure you check your own blood pressures at home. You know, these are the things to me you want to make sure you're doing. If you have a high cholesterol, don't ignore that, because that's not going to do you any good either. So in the end, in finality, why is all this vital? Because I want to see you live. I want to see you have a good life and a healthy life. And to do that means you have to do some things that you may not always want to do, but that you should do. You know, and if you look at other countries, they have a higher life expectancy than we have in the States. And that's because, a lot of times, because of lifestyle. So I'm saying all this wholeheartedly. I joke around when we do these things, because you got to laugh sometimes in this job, because that's part of what creates relationships. But, you know, the seriousness of it is I see people die more than I want to see them. And I hate when my older brother's is a physician too, and you know, sometimes we'll talk, just having our conversations about the day. And he made a comment to me. He had a patient that was just told him he was 61, African American brother, and just good guy. And I know him too, as I knew him from he's not a patient of mine, 'cause he doesn't have heart issues. But he made a comment to my brother, said, listen, I'm just glad to see 61, because none of my family lived past that. 61? This is the kind of thing that I am. And he was grateful that he lived to be 61. He was just turned 61, I think, the week before, my brother told me. You know, and this, I mean, when you look at life expectancies of groups, it's not so much genetic, it's lifestyle more than it is genetics. So I bring all this up to say that, you know, take charge of your own health. You know, do the right thing. Go out there, make sure you get your screenings done. Talk to your family members, make sure they're doing it. One of the biggest challenges I have, and this will be my final comment, the biggest challenges I have is when you deal with families. I have folks that would get upset, you know, the grandma comes to the hospital, they get, they have bad heart or whatever the case may be. And we'll get some family members fussing at us, saying we're not doing enough in their mind. And the first question I ask a lot of them, I say, well, I've been taking care of your grandma for about 15 years. Who are you? And where have you been? You know, I have not seen you at any of her appointments. You hadn't called to find out what could I do to help grandma live a better life. Nothing. But yet you come in here and fussing because you feel like, well, should I fuss at you about what you have not been doing? You know, because again, health is not just a doctor thing. It's a patient thing, it's a doctor thing, and it's a family thing. And everybody has a role to play, you know, in terms of promoting that good health. And you all know, listen, I got tons of trifling family members, you know, that don't do anything, but they call me every 5 seconds when something's going wrong. And I mean, we all have them. You know, but trying to teach people, but trying to get them engaged in good health, to understand why things are happening the way they are and how they can prevent it. That to me is the challenge that we have, but that's where our focus should be. So look at I'm not gonna say y'all have trifling family members, I'm talking about my own. I got tons of them, you know, and you know, they're always calling for something, but that's just family. I love them to death, but they trifling. But that's okay, I can work with them. You know, but I say all that to say that, you know, the whole point of all this is how do I help you live that best life? Thank you.